clinical pathways could give guidance to practitioners on what is appropriate or not to use in a certain indication. I know the companies that set up clinical pathways put a lot of effort into having a fair assessment of the field and seeing what's maybe beneficial for a patient and cost effective. The data keeps changing quickly, and we know that one of those assessments takes a period of time. I think by now, whatever assessment was done with PD-1 blocking antibodies needs to take into account that a great majority of the patients who respond up front will continue to respond, at least in melanoma. And it's having patients not have to have other treatments that is the biggest saving for this class of therapies. If the patients have a lower risk of having complications due to progressive cancer, do not have to go into the hospital because of toxicities, do not have to go into the hospital because of the tumor is growing and giving an emergency, all of that should be incorporated and may not be seen by the initial readout of the randomized trials or the pivotal trials that led to the approvals. So I would argue that the clinical pathways, which are based on taking raw numbers from pivotal clinical trials, may underestimate the benefit of agents that are giving long-term, long-lasting responses to patients that had a metastatic cancer that the normal course would be that would get worse over time, and now it's been changed and reversed. I think clinical pathways can guide practitioners that are not that used to a specific cancer to make sense of the data and say, aha, I think this is the right, best treatment for my patient. I'm a medical oncologist that dedicates all the time to melanoma. It's logical that I'll be going to the sessions of melanoma and I'll be reading the papers and I'll be looking for abstracts. I'll be thinking, in this situation, what may be the best option for a patient? I would not expect that a colleague of mine in the community who sees 20 times more lung cancer than melanoma would have the same time to dedicate to melanoma and come up with their own conclusions. So I think clinical pathways does help in that, the same as the recommendations from different organizations that try to say, we've looked at the evidence, we think that this is the best option. The problem is that's always based on the evidence that was available at that day, whenever they did that recommendation. Evidence changes over time. So I hope it's that evidence taken in the context of any new information that may be available.